Welcome back to this series on self-help acupressure. After discussing back and knee pain, we will now talk about some aspects about management of shoulder pain. When one complains of shoulder pain, the common diagnosis in the elderly and unexplained pain, stiffness, and limitation in the active and passive range motion in the shoulder, we generally attribute it to a frozen shoulder or periarthritis of the shoulder joint. The pain is usually increasing at night and can affect the sleep quality. Frozen shoulder-like pain in the younger population is often attributed to tension, typing or working at a desk or computer for prolonged periods can cause shoulder pain. Similar pain arises in those sitting on the wheel during long drives. Acupuncture for shoulder pain is known to be effective for such pains. Acupressure could definitely be tried on the recommended acupuncture points which I would be describing. The local points around the shoulder are selected from the large intestine, small intestine, and triple warmer meridians that traverse the shoulder joint. The points are generally located over and around the shoulder blade or scapula. The anatomical landmarks for these points are located as follows. While abducting the arm horizontally, two hollows will form at the transition from the arm to the shoulder. Large intestine 15 is located on the anterior hollow and the triple warmer 14 is located on the posterior hollow. The next 3 points are located slightly away from the shoulder joint. Gallbladder 21 is located at the midpoint of the superior border of the trapezius muscle or the highest point on the shoulder. Triple warmer 15 is slightly inferior to gallbladder 21, approximately 1 inch below 21 on the back. Then is small intestine 9, which is located 2 finger breadths superior to the posterior axillary fold on the lower border of the deltoid muscle when the arm is adducted. For locating points around the shoulder blade, first identify the scapular spine, which forms a bony ridge that originates at the acromion and runs in an oblique angle across the scapula. Now small intestine 13 is above the medial end of the spine of the scapula, and large intestine 16 is located above the lateral end of the spine. To be precise, it is located in the angle between the acromial origin of the scapular spine and the acromioclavicular joint. Small intestine 12 is located above the middle of the spine of the scapula in what we call the supraspinous fossa. Lastly, small intestine 11 is located in a seated or standing position with the arms hanging down. The center of the shoulder blade or scapula in this posture is the small intestine 11 point. There are 2 distal points, namely gallbladder 34 and large intestine 4, which are also to be used and have been described in the previous videos. Gallbladder 34 is often utilized for problems with bone, ligaments and joint disorders. It should be used on the side opposite the affected shoulder. To remind, gallbladder 34 is located on the leg anterior and inferior to the head of the fibula. The large intestine 4, the universal analgesic point, is located on the dorsum of the hand over the web between the thumb and index finger. Now let's do a practice session. The location of all these points, except small intestine 11, can be accessed by oneself. However, small intestine 11 too can be reached by an alternative method. At each point, apply pressure with the tip of the middle finger for 10 seconds. Now use the hand of the unaffected shoulder for applying pressure. Initially, try abducting or raising the affected arm horizontally. Two hollows will form at the transition from the arm to the shoulder. Press the anterior hollow and then the posterior hollow for 10 seconds each. Now locate the highest point of the shoulder and another point 1 inch below it on the back by the unaffected hand. Apply pressure on both these points with any finger. For locating points around the shoulder blade, first identify the scapular spine, which forms a bony ridge that originates at the acromion and runs in an oblique angle across the scapula. Apply pressure with the tip of the middle finger above its medial end, and then apply pressure on the middle portion, and finally apply pressure above the lateral end of the spine. Next, locate the point 2 inches above the fold of axilla and apply pressure. For applying pressure over the center of the scapula, place a tennis ball over the center of the shoulder blade and press against the wall for 10 seconds. This will stimulate the small intestine 11 point, which was inaccessible. Finally, before winding up, devote 20 seconds to stimulate the distal points. You should be able to complete the drill of point stimulation within 1.5 to 2 minutes. Attempt to repeat the procedure 2 to 4 times in a day. Yogic and shoulder exercises are recommended immediately after point stimulation to achieve better relief. Awaiting your comments and queries.